Module 2, Genetics in Public Health Practice. 2.1 Introduction. Public health genetics applies genetic knowledge to improve population health. It connects molecular science with community health programs, policies, and prevention strategies. 2.2 Genetics and disease prevention. Many diseases have genetic components. Public health strategies focus on screening newborns for conditions like sickle cell disease or phenylketonuria, enabling early treatment. Carrier screening in high-risk populations, such as Tay-Sachs among Ashkenazi Jews. Predictive testing for conditions like Huntington's disease or hereditary cancers. Prevention depends not only on science but also on ethical, legal, and cultural considerations. 2.3 Genetics of infectious diseases. Even infectious diseases can be influenced by genetics. For example, some people have genetic resistance to HIV due to mutations in the CCR5 gene. Variations in immune system genes affect susceptibility to malaria or tuberculosis. Understanding these differences helps design better vaccines and treatments. 2.4 Genetics and chronic diseases. Many chronic diseases, such as cancer, diabetes, cardiovascular disease, and asthma, are influenced by both genes and environment. Public health initiatives use genetic information to identify high-risk individuals, promote lifestyle modifications, guide targeted interventions, such as breast cancer screening in BRCA mutation carriers. 2.5 Pharmacogenomics. Pharmacogenomics studies how genes affect responses to drugs. Some people metabolize drugs too quickly, others too slowly. Tailoring drugs to genetic profiles improves safety and effectiveness. Public health systems are beginning to incorporate pharmacogenomics into routine care. 2.6 Ethical, legal, and social issues. The application of genetics raises significant concerns. Privacy and confidentiality of genetic information. Discrimination risks in employment or insurance. Informed consent, ensuring individuals understand the implications of genetic testing. Equity, ensuring benefits of genetic advances are available to all populations. Public health professionals must address these challenges to build trust and fairness. 2.7 Genetic epidemiology. Genetic epidemiology studies how genes and environment interact to influence disease patterns in populations. Tools include family studies, twin studies, genome-wide association studies, GWAS. These methods help identify risk factors and design population-based interventions. 2.8 Genomics and public health policy. Government and health agencies are incorporating genetics into policy by developing national genomic medicine strategies, funding research into population genetics, establishing guidelines for genetic testing and data sharing, building infrastructure for biobanks and genetic databases. Policy ensures that genetics contributes effectively to public health while protecting citizens' rights. 2.9 Future directions in genetics and public health. The future holds immense promise. Expansion of precision medicine, tailoring prevention and treatment to individuals. Wider use of whole genome sequencing in clinical practice. Integration of artificial intelligence to analyze genetic and health data. Stronger focus on equity, ensuring low-resource settings benefit from advances. Public health professionals must be prepared to adapt and harness these innovations responsibly. Module 2 Summary. In Module 2, we examined how genetics applies to public health, covering prevention, infectious and chronic diseases, pharmacogenomics, ethics, epidemiology, policy, and future trends. Course conclusion. We have now completed the course on genetics and public health. Module 1 introduced the foundations of genetics, DNA, genes, chromosomes, inheritance, variation, and testing. Module 2 connected these foundations to public health practice, disease prevention, chronic and infectious diseases, pharmacogenomics, ethical concerns, genetic epidemiology, policy, and future directions. Together, these modules show how the science of genetics can transform public health by preventing disease, improving treatments, and guiding responsible policies. Ultimately, the integration of genetics into public health offers a vision of healthier populations, where interventions are not only effective but also fair and equitable.